first we need to check whether we are breathing through the chest or through the diaphragm, that means through the abdomen, or is it a mix of both. So how can we determine how we are actually breathing? So it is very simple. So what we need to do is put a hand over your chest and another hand on your stomach, just at the navel. Just at the navel region you put one hand and another hand here at the center of your chest. And now you breathe in and notice which of the hand is detecting any movement. So when you breathe in, if your this hand, the bottom hand, is detecting a movement, that means your abdomen is moving in and out, and you are breathing through your diaphragm. Whereas when you are if your upper hand is moving, which is on the chest, that means you are breathing through the chest. It may so happen that for some people both these are moving. That means there is a mixture of both chest breathing and abdominal breathing. However, what we would like to do is go to abdominal breathing completely. So we wish to be in a mode where we are breathing through the abdomen all the time. So there should be no chest breathing, because chest breathing causes a lot of stress in the chest muscles, as we have already understood that these are not able to move or stretch out very far, and it suffers some restrictions. So there is some stress that gets developed. So in the normal breathing that we do in our 24 hours breathing, that should be abdominal breathing, and we wish to go towards abdominal breathing. If we are doing any amount of chest breathing, we wish to restrict that, we wish to stop that altogether. How to go about with this? How to practice the abdominal breathing? The practice is also the same technique. You need to put a hand over your chest and one hand over your abdomen. And now when you breathe, the abdominal muscle should only be moving. There should not be any movement on the chest. And if you do it consciously, you will be able to achieve that. So maybe at this moment when you are breathing, your chest, this hand is moving up and down. So like maybe your chest is moving. I am doing a bit exaggerated way, but you will be able to feel a movement, feel some movement on your hand. So if you now make a conscious effort, then you can stop your movement on the chest and pass this movement to your abdomen. So see, my lower hand is moving, which is on my abdomen. So why the abdomen moves? Because the diaphragm is moving downwards, so the abdominal muscle is moving outwards to make space for it. Again, when the diaphragm muscle moves upward, the abdominal muscle will go inwards. So as we breathe, it almost feels like we are filling up the stomach with air when we breathe in, and when we breathe out, we again contract the stomach. So it is almost like filling up a balloon. So if you imagine this to be a balloon, so you are expanding the balloon and then contracting the balloon. So when you take in the air, you are expanding the balloon, and when you are letting the air out, when you are breathing out, you are contracting the balloon. So only work with the abdominal muscle. This muscle should not work. Now it might so happen that due to your not practicing abdominal breathing for such a long time, the abdominal muscles are not moving so much. So you will find some restriction. They are not expanding and contracting so much as you desire them to. So as you can see, my abdomen can move out and move in quite some distance. So you might be facing some difficulty there, but don't worry about that. because with practice that movement will again come to the abdominal muscles. So because these muscles were not worked, so they have become stagnant or like that, but if you are consciously making an effort to do abdominal breathing, they will again come and become relaxed, and you will be able to work with those muscles. Now this is the technique, this is the only technique to consciously shift your breathing to abdominal breathing, and you can always keep yourself on check by doing this to both hands, on your one hand on your chest, one hand on your abdomen, and breathe and just feel which hand is moving. And with a conscious effort you can shift your movements only to the abdomen. So that is what you need to do, shift your movement only to the abdomen. So by conscious effort you will be able to achieve that, and within no time actually, because if you keep this in the back of your mind, whatever work you may be doing, you just remember that I have to check it. So you just place your hands on your chest and your belly, and you check whether you are doing abdominal breathing or not. And in this way, if you are checking yourself all the time, then you will be able to shift to abdominal breathing within 7 days or maximum 10 or 14 days. Now it is not necessary that you have to stand up like I am standing here and showing you this technique. So it is not necessary that this technique has to be done while you are standing. You can do it while you are sitting somewhere. You can even try out this while you are lying on your bed. So when you lie on your bed, you just put your one hand over your chest, one hand over your belly, and that time almost everyone will experience that you are breathing through your abdomen. Your abdomen is moving that time when you are lying down on your bed. So lying down means facing upwards, you lie down and you experience that you are actually doing abdominal breathing that time. But when we are awake, when we are walking, when we are sitting somewhere, normally our breath comes to our chest, which we need to avoid. We need to do abdominal breathing that time also, and that's why this practice is helpful. So just remember, you can do it anytime, you can practice this anytime. There is no restriction of any posture or anything. You can always give your conscious effort and conscious mind to just check this, whether you are doing abdominal breathing or not, by this simple technique.